At-home LED masks, a real skin game changer? LED masks are everywhere on social media, with people claiming they're getting professional level results at home. But here's the truth. Most of these masks are overpriced toys that barely work. Hi everyone, I'm Dr. Weinstein. I'm a board certified dermatologist and I use professional LED therapy in my office daily. Today, I'm telling you which at-home LED masks actually work, which are scams, and how to get real results without wasting your money. So what is LED light therapy really? LED stands for light emitting diode. It uses specific wavelengths of light to trigger cellular responses in your skin. There is science that shows it actually works. So red light emits wavelengths between 660 to 850 nanometers. And at this wavelength, we're stimulating collagen production. Blue light is a 415 nanometer wavelength that actually kills the bacteria that causes acne, and it also has some anti-inflammatory benefits. Now, the near-infrared wavelength is about 850 nanometers, and that also helps to reduce inflammation. Your cells absorb that light energy and then convert it to reap the healing benefits. So I had a patient named Sarah who used professional LED after microneedling. Her acne scars improved up to 40% faster than microneedling alone. The key difference here is that professional devices deliver 10 to 50 times more light energy than the at-home mask. So not LED masks are created equal. Now here are the ones with real power. Current Body Skin LED mask runs you about $380, but is FDA cleared for wrinkles and acne. It has 132 LED bulbs with clinical strength output. It has both red and near-infrared wavelengths, and it actually delivers therapeutic doses. There's also a device called LightStim, which helps with wrinkles. It's handheld but effective. It's FDA cleared with clinical studies, and it runs across multiple wavelengths for anti-aging. It has a more affordable entry point. The Dr. Dennis Gross DRX Spectralight Facewear Pro, that's a mouthful, but it runs about $435. It combines both red and blue light, and it's good for acne and anti-aging. It has a really comfortable fit and design, and it's dermatologist developed. I also like the Eye Restore LED mask. It emits all three wavelengths, so it's going to have anti-inflammatory, anti-aging, and anti-acne benefits. That's a great one to consider. It runs you about $500. Now here are some masks that you might want to think twice about. They're super popular, but some can be pretty expensive night lights. There are a whole range of cheap Amazon masks for under $100. Now, these deliver a very weak LED output and they're barely therapeutic. They might have the wrong wavelengths or mixed colors, so you really want to look into that before purchasing a mask. Also, there's no clinical data or FDA clearance, and so that's a huge waste of time and money for anybody who purchases these Amazon masks. Now, you might have heard all of the hype about the Omnilux mask. I don't think it's a bad mask, but it is very expensive. And from what I've seen, the marketing hype actually exceeds the performance of the mask. It tends to be way overpriced for the actual light output, and I think there are better options available for less money, as we talked about earlier. Now, any mask claiming to do everything, so anti-aging, acne, hair growth, pain relief, if it promises to do everything, it probably does nothing well. So I would stick to devices with specific proven claims. Now, here are some red flags to avoid. So if there's no FDA clearance mentioned, if it promises overnight results, or if it uses terms like NASA technology, there are no clinical studies to back these claims. You really need to look into the science and the data. Now, let's set realistic expectations because LED isn't magic. What can LED actually do? It can reduce fine lines by about 10 to 20% over the course of 3 months, but that's with consistent use. It can also improve acne by about 30 to 50% in 6 to 8 weeks, again, with consistent use. Under professional lights, it can reduce post-treatment recovery time and speed up that healing process, but that's typically in office only. It can also improve overall texture and skin glow, again, when used consistently. Now, it's even more important to note what it can't do. So it definitely can't replace Botox for deep wrinkles or eliminate severe cystic acne overnight. It doesn't tighten skin significantly, and it doesn't work after just a few sessions. The reality of the timeline is it needs to be used daily for about 10 to 20 minutes, and most masks have the daily protocols outlined in the instructions, so make sure you read those carefully. You might see results in about 4 to 6 weeks, but it might take longer and up to 3 months to see significant results. And again, ongoing use is required for maintenance and also for results just in general. Now, I had a patient named Mark who used the current body mask for about 3 months, and he found that his fine line softened, but his deep forehead wrinkles really needed Botox. LED enhanced his results, but didn't replace professional treatments. I always say it's a nice adjunct treatment to the things that we're doing in the office. And if you are having procedures like Botox and lasers and skin tightening in the office, it's nice to then go home and maintain those results with LED. Most people use LED masks wrong, which is why they don't see results. So they don't use the proper technique, which involves really cleaning the skin thoroughly before applying the mask, so you shouldn't have any products or makeup on the skin. Also, consistent daily use is key, so use it the same time every day. Integrate it into your nighttime self-care routine. Make sure you protect your eyes if your mask doesn't actually cover them. And also make sure you adhere to the full treatment time. Don't cut your session short because you'll just be drawing yourself a short straw and not seeing the results that you really want. Now, here are some common mistakes. If you use it over serums or moisturizers, you could potentially block the true effect of those LED lights. Also, using it inconsistently. Missing days can ruin your progress. If you expect to see results after just 1 week, then obviously your expectations are not correct. It does take time to see results. Make sure you check with your doctor if you're on prescribed medications, because there are some medications that can prohibit its effectiveness. Now, here are some safety considerations. Don't use the LED mask if you're pregnant or breastfeeding. Please check with your doctor or OBGYN about the things that are safe to use during that special time of your life. Also, avoid these light masks if you're taking photosensitizing medications. And again, that's something to check with your doctor on. Make sure you stop your LED if you develop irritation or any sort of headaches, and do not look directly into the LED lights. And something I talk to my patients about too is if you have the propensity to hyperpigment, or you're struggling with pigmentary issues on the face like melasma or discoloration or brown spots, then LED is probably not the right treatment for you. Now let's do a quick comparison looking at professional versus at-home devices. Here's the honest comparison. Professional LED lights have advantages. They're about 10 to 50 times more powerful than at-home devices. They also deliver faster and more dramatic results. You might need to sit under them for less periods of time. They're best when combined with the other treatments, and that's really what you can do in office with a board-certified dermatologist. You can also customize them to your specific needs. So if you're using it for anti-aging versus acne, there's a whole host of different ways that we can customize the in-office LEDs. At-home LED advantages are many as well. So they're convenient because you can use them daily. They have a lower long-term cost, of course, and you're in the privacy and comfort of your own home. And it's good for maintenance in between professional treatments. So my recommendation is to start with a professional treatment and see if LED works for you, then maintain with some quality at-home devices. The cost reality of it all is that a good at-home mask is probably going to be about $300 to $400, and it ends up paying for itself versus multiple professional sessions, which can be about $100 to $200, but it might be worthwhile investing in that professional treatment at first and then getting some guidance from your dermatologist on how to proceed with at-home treatments. So in conclusion, LED masks can work, but only if you buy quality devices, use them consistently, and have realistic expectations. They're not miracle workers, but they can definitely be valuable additions to your skincare routine. Skip the cheap Amazon masks and invest in FDA-cleared devices if you're serious about results. And remember, LED enhances other treatments, but rarely works as a standalone solution. Have you tried LED masks yet? What were your results? Drop a comment below. I read every one, and I can help you choose the right device for your skincare concerns. Subscribe for more honest reviews of trending skincare devices.